The issue of kidneys or kidney disease has been very alarming. Unfortunately, sometimes we even see young people calling out on the general public to make donations so they can go for therapy or surgery or just to be able to treat it. First, some of us used to hear about kidney disease in the movies, but now it has come very close to us. What are we doing wrong? Are we not taking care of our bodies, or we are neglecting something? Today on the show, we want to have a conversation on kidney. We want to find out how we can take care of our kidneys and how we can be able to stay strong and healthy, especially for young people, the youth, under 30, under 40. Always kidney issues, kidney diseases. Let's go for a break. We'll be back to have a great conversation.
My name is Sule Barika. I'm from Yawako community. We came here for the Lead Decide program in collaboration with the Plan Ghana. As we came here, we learned a lot. We learned about self-determination.
My name is Mahmoud Dorita. I come from Guablaga. I came here for the Lead Decide program. And when I came here, I learned a lot of things. Things like I learned how to determine myself, know my weakness and strength. And I really appreciate and say thank you to Mata Inspire Foundation.
My name is Faisal Faiza. I'm from Gbanu community. We came here to learn about self-determination and self-weakness.
And due to that, we learn about our strengths and weakness points, what we know, what we like and what we dislike in order to help other people. So thank you, Mata Inspires Foundation.
Welcome back from the break. I am Martha Inspired. Like I said in my intro, today we want to have a great conversation on kidneys. The issue of kidney failure, kidney disease has become very alarming, and most of us do not even know. I don't think I have even gone to check my kidneys. I always say I'll go and do it, and when I get to the hospital, I only tell the doctor what is wrong with me at that moment. I'll be like, I'll get time and go for a checkup, and I don't do it. It's a Ghanaian thing, unfortunately. It's an African thing, if I must say. But we all need to do better. I have been joined here by Mr. Dakura Eric. He's a nurse nephrologist at the Tamale Teaching Hospital. And Mr. Afimpogu Simon Benako. He's a nephrology nurse resident at the Ghana College of Nurses and Midwives. He's also at the Tamale Teaching Hospital. They'll be helping us to understand everything about kidney health and what you and I can do to make sure that our kidneys are safe, and especially with those growing. Like, if I say with those growing, because there are times that we think some of these things are just for the aged, the old men and the old women, but unfortunately we see the younger ones in their 20s. Some people calling for help. They need $10,000, $20,000 for kidney transplants and all of that. But we can do better. Thank you very much for joining me on the show.
Thank you.
It's a pleasure
for having us.
So, straight to the point, we usually have, you have been nurses, or let me say, health practitioners in that field. Before we get straight into that, has the number of cases of kidney failures, like for me, I see that they have been increased or they are alarming. Do you see that in your facilities? Let me start with you.
Actually, of recent times, the numbers are overwhelming. Not only in Tamale here, even in Kumasi, in Accra. You can even testify with the number of private dialysis centers that are coming up in the system. So all these are things which tell us that the numbers are actually overwhelming. But it's sad that many of these people that are down with these diseases are those in the working class, that is the younger and
The strong force, the youth.
Yes. So we are always, or those ones, most of those ones are people of that age bracket.
Mr. Simon, what do you think we are not doing right? That most of us, the strong, we say we are strong, right? Because we are the youth. But we have this
Yes,
issue.
actually, we are not doing right, and I don't want to blame the society because we, the health workers, too, are not doing the best. We need to go to the people. Some of them do not know the causes, and they don't even know what is causing the kidney disease. It was known that the aged who were suffering from kidney disease, but now the working population between the ages of 20 to 50 in Africa and Ghana, most of them are in the working class. They are suffering from these diseases that are in the with us.
Okay.
And it's very, very, very expensive, and it's traumatizing to have a family member suffering from this disease.
Okay.
I think we need to go down to the education, the advocacy, to let people know what kidney disease is, as we are doing this morning.
Okay. So let's go get a bit scientific or a bit into our bodies. What is the kidney? How does the kidney look like in our body? Yeah, Mr. Simon.
Yes, the kidney, we can say, is a bean-shaped reddish organ. They are located at the high and upper back of our abdomen, just opposite the spine. And every human or adult have two kidneys. Most of us have two kidneys.
Okay.
Both of them work together, but you can live a healthy life with one kidney.
But there are some people who have just one kidney.
Yes, but that is...
And they are born with it normally.
Yes, they are born.
Okay.
Some have gotten it through surgery to save their life. Maybe if one is affected, they can do surgery to take one, and you can live a healthy life with that. But both of them normally work together to ensure a healthy life.
Okay.
Yes.
Okay. So what conditions or what makes one being born with just one kidney and one being born with two kidneys?
If you look at it, there are several conditions that can let one be born with. One is born with one kidney. One is other birth abnormalities. Let's say at birth, everyone is born with, one can be born with these kidney abnormalities. Let's say when you are born preterm, you are born before term. Your kidneys are not well developed and you are born.
Okay.
Definitely you have those abnormalities, and growing up you will develop some of these kidney problems.
So it means that it even goes as far back as when you are in your mother's womb.
Yes.
And how you are being developed.
Yes.
Your body might not be developed completely, so it can even affect your kidneys. Wow. What does the kidney do? It comes to you.
The kidney has a lot of functions, but the main function of the kidney is the filtration of toxins and waste substances from our bodies. And it does this by these waste substances leaves our bodies in the form of urine. So the urine we actually produce is a cluster of things. That is the basic function of the kidney. But it also have other functions, such as, let me say, in technical terms, we say homeostasis. That is, when we drink a lot of water, these kidneys take off the excess one that the body doesn't need. And these are why when we drink plenty water, we tend to pee more. So it is the kidneys that are removing the excess water from our bodies. Then the kidneys also play a hormonal role. And this hormonal role is, they produce a hormone called erythropoietin, which is good. Yes, it's technical, kind of. It is good in it helps in the making of the blood. So those who tend to have kidney disease tend to have problems with their HB levels. So their HB levels tends to go down. They also play a role in the regulation of our blood pressure.
Okay.
Those with kidney disease, if you have kidney disease, your blood pressure, it's always high.
Okay.
And blood pressure too can cause kidney disease.
So if you have a high blood pressure, it means that you are at
You
a high
are
risk.
of developing.
So you have to go and check it
Yes.
out.
Regularly. Then the kidneys also have a role in strengthening our bones by helping with the calcium and phosphates. We all know that calcium helps in bone formations. So the kidney also plays a role in that. Then the kidneys also, I think,
Yeah, go ahead.
Okay, yes. I think another major function of the kidney is to make blood. When
Okay.
we talk of to make blood, you know, the kidney plays a role in the production of red blood cells. When you go to hospital, they say your AB is low. It's the kidney that normally informs the bone marrow,
Okay.
yes, to produce those red blood cells, to be able to do that. They also help in, you know, with the production of blood, we need iron. They help in the absorption of iron that we eat in food. So when you eat, it's being absorbed so that it will help the bone to make this kind of blood we are talking about. So mostly those patients with the kidney disease, they suffer, most of them are suffering from anemia because of that problem.
Okay.
Yes.
Okay.
As it's even said, the acid level, and acid level is being controlled by the kidney. So when the acid level is high, it has an effect on your body. So the kidneys also do that for us.
Okay. He mentioned one of the causes of kidney disease. That is, if the baby is not formed well in the mother's womb and all of that. But I want us to go and look at what are some of the causes that we can see more. What causes some of these kidney diseases?
Yes, we talk about as we talk about the congenital abnormalities, mostly our mothers, when they are pregnant, they don't attend antenatal.
Okay.
You are supposed to go for antenatal and they'll give you, there are some medications or supplements they'll give you to help so that the baby will be able to develop well. So when a lady in a particular community fails to do that, at the end of the day, the baby may not be able to form well. So the kidneys may not form even the normal size. Sometimes the tubes, or we say the ureters, that are supposed to allow the blood, the urine to flow through, maybe develop in a way that they will never be able to do that. The bladder too can also have an effect.
Okay.
So normally we ask them to go for the antenatal so that through scan they can even identify
and
the
know all
condition
these things,
while the baby is in utero. So these are some of the challenges that we have. Some of them, the mothers, they take a lot of substances, medications, alcoholism, smoking, which can further cause this kind of
Okay.
congenital.
So smoking and drinking all can affect our kidneys.
Yes,
Wow.
they are part of the risk factors that can bring that. Yeah.
What other things can cause one to have a kidney failure?
Some of the causes of kidney failure, as he rightly mentioned, there are some people that kidney failure self-run in families. We have something we call the polycystic kidney disease. That one, it runs in families. So if somebody in your family is having kidney disease, you are also at risk of developing kidney disease. Then if you are hypertensive, as I mentioned earlier, you are also at risk of developing kidney disease, as well as diabetes. These are some of the things that can cause kidney failure.
Okay. So at first we used to see that people who are aged have these things. I asked my first question on the youth and all of that. Like, what do you think we are not doing right between, let's say, 20 to 40 years? What are we not doing right that is like for a long... It's been a long time I've even heard like an aged person has kidney failures.
Yeah.
Some of these fundraisings you see online, they are mostly the youth.
Yeah. I think what we are not doing right, we have something we call it risk factors.
Okay.
Risk factors are just, let's say, assuming somebody who has built his house along the road. His animals are exposed to a car
Accident.
knock, as compared to somebody who stays in a village, whereby his animals are not prone to that. When you look at what the youth they do now, as I talk about the alcoholism, it's one of the things that the youth are engaging, the smoking. We don't even know our family, as Mr. Eric said.
Yeah.
You need to know whether your family there is diabetes or hypertension there. Yes, if you are able to know that, you're able to do things right, that may know what expose you to the kidney disease. We also have in their hospitals now, people go for scan, CT scan. There's something they will call a contrast medium.
Okay.
Normally, before you undergo that, they are supposed to know your kidney function level before they give it. Because when you take it, they give it at the hospital, you are likely to develop kidney problem.
So some of the medications we take at the hospitals.
Yes.
Wow.
Yes, some like.
So why do you put to give it to us?
Yes.
Or they are meant to treat something else?
Yes, mostly we give it to you. When you are giving at a hospital, it's even better. One of the major causes is the chronic painkillers. You know, pain is something that everybody cannot resist. And people tend to go to the market. Some even go to the markets where people are selling over-the-counter medications. When you buy those painkillers, you continue to take them. They reduce the blood supply to the kidney. So, and the kidney needs a lot of blood to work. So some of them do that, and they iron out with the kidney disease. Some of them are also taking chronic, they are on chronic herbal medicine. Something they will say is natural. A drug that is being advertised as natural is not the way, it's not natural as we say. So when you take chronic, those herbal medicine for a long time, you are exposing yourself to what? Kidney disease. Some of our youth also engage in these aphrodisiacs. They take this kind of aphrodisiac to be able to perform well, to satisfy a lady. At the end of the day, when you are down with the disease, that lady will run away and you'll be left alone. So these are some of the things I think we are not doing right as youth.
Okay.
Yeah.
Anything to add up to that?
Let me also add that everyone at birth, you are born with 1 to 2 million nephrons. And the nephron is a functional unit of the kidney. And after birth, they don't increase in number again. The number you are born with, that is the number you will.
No matter how old you grow, how
Yes.
tall you become.
Yes, you will have this number your entire life. So if you engage in some of these activities, the drinking, the smoking, eating of other foods, just your normal life, some of these, it actually affects some of these nephrons and they start dying out. So that's why we always project that this disease is for people who are above the age of 40 years. But now, it is now with us because of what we eat. If you look at it nowadays, all our food, especially in Ghana here, the salt. Salt is just always
In
the
every
thing.
food, yeah.
Many of us like
So
love
much salt can also.
Yes,
Hey.
it can predispose you to kidney
Wow.
failure. And just as he was talking about the herbal medications, there is sufficient evidence that prove that there are some of them that when you just take it, at that moment you can develop kidney failure. And yes,
Wow.
and when you take it over and there are some too, when you take it over a period of time, they tend to give you this disease. I sometimes had a patient from the Upper East region. For him, he came with, he had a kidney problem as a result of the abuse of NSAIDs, just the paracetamol.
Okay.
He used to say that those days he drives from Accra to Upper East. And when he comes like that, because of tiredness and those things, he will just break the whole 10 tablets and then take it.
Wow.
Then that way he rests well, and then he's okay. Not knowing that
It was causing something
gradually, he was destroying his kidneys, and he ended up on dialysis.
I want us to go for a break. When we come back, I want us to look at the signs and symptoms. What will make you know that you are at risk, or you even have, or even your kidney has started getting bad. Stay tuned, we'll be back.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back from the break. I believe that you and I today are learning something new about how we can take care of our kidneys. And then I want us to look at some of the signs and symptoms, but I think I want to find out, we've spoken so much about what we eat, what we drink, what we take into our system. But apart from taking something into our system, are there other things that can probably expose us to having any sort of kidney failure? Sir Simon?
Yes. There are other things that can lead us to that. The fact that you are even a black, you stand 4 times chances of getting the kidney disease.
Just being an African?
Yes, being an African.
Wow.
It's even exposes you to it. And those who are also sickle cell. Sickle cell, yes, is one of the factors that can lead to that. Yes, so there are some of the factors that I think they can add to the risk factors.
Okay.
Then to add to him, poverty is also one of the risk factors.
How can poverty be?
Yes, many a times you see those who are poor, they tend not to have money to go to the hospital when they have kidney disease or when they are sick. Let me just put it that way. When they are sick, they don't have money to go to the hospital. So whatever that is available, or whatever medications that is available, is what they will do with. Even the feeding, as we are talking about what we eat, they don't have the money to buy, good meal to eat.
Good food, yeah.
Yes.
Yeah.
So what is available to them is what they will eat, and it tends to predispose them to kidney failure.
Okay.
Then even these bodybuilding, lifting of heavy weights.
Gymming.
Yes. It can also predispose one
Those who want the 6 packs.
to kidney disease.
Okay.
Yes. Because when you are doing the gymming and then those things, you are breaking down your muscles. They break down in a way so that they expand. And as you are doing that, there is something medical we call rhabdomyolysis.
Okay.
So the kidneys are supposed to excrete these acids that are accumulating in your body. And when they accumulate over a time, they tend to cause this kidney failure.
Okay. So now let's go to the signs and symptoms. What would I find or notice in my system that would tell me that probably I have a kidney failure? Mr. Simon?
Yes. This thing, I would say, unfortunately, one of the problems we have with kidney disease is that the symptoms, you may lose about 90% of the function of the kidney without having problem or getting to know. Yes, they come, the symptoms come late at a stage that you do not even know. So mostly that's what happens.
Wow.
It works like your phone. When you have your mobile phone, until you alarm bells that your battery is low, you don't know. But with the phone, you can easily go to charge it. But with the kidney problem, when it gets to a stage that it cannot be reversed, you cannot do anything. You only try to manage you and try to what? Make sure that we slow your movement to the stage that you need to depend on maintenance dialysis or transplant. So mostly some of the common things that you see in the with the kidney disease, it normally appears with you get swelling of the face and the legs. Mostly the face comes in the morning, but any other condition like liver problem can bring that. But with the kidney, we seem to see those things that are happening. Sometimes you may have a foamy urine. You urinate and the urine will be foamy. It's something that it can lead you to what? You know that yes, you have. Some of them are having persistent BP. The blood pressure is just going up. And you know, we told you about the functions of the kidney that it helps to regulate the blood pressure. So when your BP is going on consistently and medications are done and you are not getting a result, you need to what? Go for checkup to know that it can be a signal to that. Some of them can have a loss of appetite. Some of them vomit. Some of them urinate blood.
Wow.
Yes. So these are some of the things that you may also have. Some of them might have difficulty in breathing. You know, we talk about the accumulation of the waste.
Then that's even the last stage, cry.
Yes. But it can signal that those things are happening because as you talk about the homeostasis, some of this accumulation of like potassium, calcium, and they have effect to the heart and your general body. So when those things are, the toxins are accumulated, they tend to cause this kind of this. Some of them actually come to the hospital through a shock. You can be at a wedding ground or anywhere and you all of a sudden go into coma and you rush to the hospital. Through series of investigation, they may find out that yes, you have kidney disease. So these are some of the things that are deadly and it's difficult. The diagnoses are very, very critical. So they come in late because you can live with the kidney disease and without knowing the signs and symptoms until it's late.
Okay.
Yes.
Okay. Anything to add up to the
Yes,
signs?
as you rightly mentioned it doesn't come with any sign and symptom. The time you are seeing those signs and symptoms, it is actually late for you. And many of the cases we see, about 70% of them comes at this last stage. And it is sad that we lose 50% of them because they come at the time that they are seeing some of these things. Your lungs are filled with fluids, you are coming, you can't breathe well. There is that confusion, there is coma, the patient is unresponsive, and then those things. So most of them, 50% of those ones, even as they report to the hospital, we lose them.
What do you think we can do better? You've mentioned the poverty, you've mentioned all of that. Sometimes, do you think that self-medication to is at it? Because you feel that something is wrong with you, you don't go to the hospital, you want to self-medicate. Is self-medication one of the reasons why we don't detect some of these things early?
Yes, as we spoke earlier on, people tend to go to drugstores or chemical shops to buy medications because they have headache and it's pain. They tend to go in for these NSAIDs, such as diclofenac, naproxen, aspirin, and all those medications that are what.
So they might even be treating the wrong thing.
Yes.
Because maybe the kidney is beginning to have an issue, but it's not showing some of these certain symptoms.
Yes.
So they'll go and buy something thinking that it's something else, and it ends up, let me say, like you mentioned, the man that takes the medications because he's tired, not knowing that he's affecting his kidneys.
Yes. As we talk about the pain, and then some are indulging in the herbal medicines. You know, we say natural. Assuming I've given you a banana, the banana is natural. Why do you throw away the pills and eat the other part of it? So a drug that is being advertised is not what natural as we talk. And most of our people tend to believe those who are doing this medical. Some of them, as he said, research has proven that they cause kidney disease. And most people, the danger about that, the people continue to consume it. They don't know the dosage. When you go to hospital, they'll be able to tell you that this medication, take it for 1 week. And this number of meals. Take 2 tablets in the morning. But with some of the herbal, we can't just say all of them. Some of them are being incorporated in our health system, so they will. But how many are they?
That's true.
Those who are selling the fake ones are more in the system. Drugs
That's
are coming
also
from
affordable for those who are poor.
Yes.
Because when you hear that, so they're selling this medicine, depending on your pocket, you just want to go and buy. And when you find a little relief, you're okay.
Yeah.
What are some of the complications that kidney disease or kidney failures can happen to the individual? Mr. Eric.
One of the complications of kidney failure is many of them become unconscious. Then some of them, they are unable to,
All right,
Okay,
go
so
on.
let me add to, yes,
Okay.
as we
Yes,
spoke earlier on, some of the complications, the high BP. Yes, the BP, I spoke earlier on that it will be high. And we talk about the anemia, whereby your blood level goes down because the kidney is not able to do. Some of them suffer stroke. Some of them suffer heart failure. Yes, so these are some of the, and as you continue to...
So with kidney, you can also suffer stroke?
Yes, because it normally it works, as you said, it controls the what, the heart pump through this kind of potassium and all those calcium. Those are supposed to help in the heart to pump. When you continue to have increased BP due to the kidney disease, it can rupture some of the smaller blood vessels in your brain, and you suffer that. So it can lead to that through the high BP. Yes.
I want us to look at the preventions, then we'll come to the treatment options. So how can we prevent some of these things like kidney? Yes, like how can we, how can we prevent ourselves from being at a high risk of that? Okay.
With the prevention of kidney disease, the major thing is that if you know you have hypertension, you have to stick to the treatment regimens. If you know you have diabetes, you stick to the treatment regimen. Diabetes causes kidney failure by leaking proteins. And when these proteins are leaked through your urine over a period of time, you tend to also develop kidney failure. So if you are diagnosed with diabetes, you have to stick to your medications. Then if you also have the hypertension too, same. Then we have to avoid over-the-counter medications, as we mentioned earlier. If you are sick, you get to the hospital, then they prescribe medications for you. And many of these prescribed medications, we actually tend to know your kidney function before we give you those medications. And drugs that we will prescribe for you when your kidneys are strong will be changed when there is a defect in it. So actually, it is safe, as you were saying, to come to the hospital for treatment. Then one of the ways we can also prevent kidney disease is drinking a lot of water. Water doesn't have any side effects. And I earlier on elaborated that the kidneys remove excess water from our body. And the more we drink the water, it makes it easier for the kidneys to cleanse our body of these toxins. We have to avoid smoking. If you smoke, then you have to also avoid alcoholism or drink in moderation. But when we say in moderation, what do we mean? Somebody's moderation it's way high. You can take 10 bottles of
That's
whatever.
their moderation.
Yes, and that is their moderation. So moderation is relative. So then we have to also do a regular checkup. I always advocate that we should always get a day we call a medical holiday, where you set this day aside, you come to the hospital.
But I let you, Paul, when we come to the hospital and it just check up, you be like, other people are having serious issues at the what's the name, ICU, and you are healthy, you just want to come and check your body. I've know people that have gone to the hospital and they get to see a doctor, especially the government hospitals, and they get to see the doctor, and the doctor is like, oh, you wait, well, let me attend to the emergency cases. Do you think that the doctor to patient ratio is a cause of that? Why doctors or health professionals do not take checkups seriously, except in the private hospitals? You can't just walk into a government hospital unless you have a personal relationship with the doctor. If I should come to TTH with all the queues there, and I come into your consulting room and I'm like, I want to come and do a checkup, how would that be?
Let me come in. Yes, in the first place, as we say, people do not even know how dangerous kidney disease is, as we talk. And people go to the wrong places when you are seeking for help. As you talk about TTH, you yourself should decide, what do I want to know? Yes, there's no health worker who should return a patient. We actually go to the hospital not when we are sick. That is the mentality of Africans and Ghanaians. You go to the hospital to either check whether you have a problem, or when you have a problem, you want to treat it. As you said, if you go to a unit that in the consulting room whereby the doctor is already attending to emergencies, normally before you go to the hospital, you consult somebody. Where do I go? If you want to know the kidney function,
there's a place you have to go.
You go and you are standing at a different part of the hospital. You will not be taken care of. Sometimes you even delay in getting the folder. By the time you get the folder, you are at the wrong side of the hospital. So you see that at the end of the day, you come back blaming the facilities for not taking care of that. But you yourself you should have consulted people that will direct you.
There.
Yes, there are places like the polyclinic is open to everybody who you want to go. When you go, and there are some labs that they will do. They should be able to tell you that, oh, yes, do these labs. Then from there, when they identify the condition that you are suffering from, they refer you to a specialist. TTH is supposed to be a tertiary, as we are. We are tertiary, so there are some laid down rules. If you want to leave everybody in Tamale to go to a specialist with malaria or typhoid.
Yes, I learned that. I think there was a time that they were told that if you have minor complications, you go to other hospitals. They will have to refer you to TTH. If you just walk in and go there, they might ask some, I don't know, but there was like this rumor going on that you would have to go to TTH with a referral. You can't just walk into TTH. Or I don't know if they were now trying to bring that policy.
We currently have a polyclinic. Yes, actually we actually do internal referrals. As I said, when you go to the polyclinic, anybody can walk there for a checkup or treatment. When they see that the condition is beyond them, they will now refer you to see a specialist. And the specialist too, they have a consulting days. You don't just go there any day. Yes, they have Monday, Tuesday up to Friday. So maybe when you are going to for the renal clinic, you ask for the date, you go for a booking. Then you say, yeah, come this day, the doctors will be there. You can go on a different day. The consulting room is being used by other specialists because there are many conditions that people are suffering from.
We don't have a lot of rooms.
Yes. So the way we go to seek for medical checkup is not the right way. Yes.
Now, let's look at the treatment options of kidney disease. What are the treatment options available to us?
Actually, if you look at the treatment of kidney disease, we have the management, like the hemodialysis, and which is the main one that we in Ghana here are doing. But the only treatment of peritoneal dialysis, with that one, fluid is inserted into your abdomen for some number of hours, and then you go and then remove it. Then with the hemodialysis, that one, it is a machine that your blood is passed through to cleanse to do the work of the kidney. That is taking off the toxins. That is why we refer it to as the hemodialysis. Then the only treatment available for kidney failure is the kidney transplant. And many of us cannot afford. Even in
That's
Ghana.
taking someone's kidney to put in yours.
Yes. That is the only treatment that is available as of now.
The others are managed.
They are management.
So even with the plenty medications they will say you should buy, you take, and they're very expensive.
Yeah.
Yes, they are quite expensive.
Yes. As we said, the chronic kidney disease is made up of stages from 1 to 5. So normally they do the investigations to know which stage are you.
Okay, so you take us through the stages.
Yes.
What does 1 to 5 mean?
Yes.
Yeah.
When you go to a hospital, first we try to run various types of check. You can test your urine, you can test your blood, they can do a scan, abdominal scan, to know the kidneys. Are they in normal size? Are there any stones in the kidneys? Are there any maybe a tumor somewhere that is blocking the urine? After that, they will now classify to know when were you suffering from this disease. And normally, the disease it comes with a lot of conditions. Maybe you came with the disease due to your diabetes or your high blood pressure. We try to tackle those conditions alongside. Then most of them are, you will be on medications to treat comorbid conditions that are contributing to that, because you came with that, those kind of causes. So you factor into that. Then we now know when you are in stage 1, you can go about, even though there's a disease, damage to the kidney, but you are still doing well. Your urine, you are urinating well, your electrolytes level are well. Then you move to stage 2, you are still doing that.
Before we go to stage 2, I want us to take a break. We'll come back, look at the stages, look at all the treatment options, then we can wrap up on that.
Okay.
Stay tuned, we'll be back.
My name is Sule Barika. I'm from Yawako community. We came here for the Lead Decide program in collaboration with the Plan Ghana. As we came here, we learned a lot. We learned about self-determination.
My name is Mahma Dorita. I come from Guabelga. I came here for the Lead Decide program. And when I came here, I learned a lot of things. Things like I learned how to determine myself, know my weakness and strength. And I really appreciate and say thank you to Matter Inspire Foundation.
My name is Faisal Faiza. I'm from Gbanu community. We came here to learn about self-determination and self-weakness.
And due to that, we learn about our strengths and weakness points, what we know, what we like, and what we dislike, in order to help other people. So thank you, Matter Inspire Foundation.
Welcome back from the break. I believe that you and I are making a decision to go to the hospital tomorrow, right after watching this episode, to check that our kidneys are good. Let me come to you straight. Just take us quickly through the stages, or let me just say what we need to know about the stages.
Yes. The stages normally, as an individual, you may not understand. There's something we call GFR. They use that one to measure how your kidney is doing. Glomerular filtration rate. So they use it to be able to know how your kidney is functioning. Normally, they take your blood to do that. And when they do it, they'll be able to know which stage are you. And they also factor your age, your sex, and where you are coming from.
Okay.
They play a role. So when you do that, you're able to classify the person. Like I said, in the stage 1, you are doing well. Maybe your kidney function is doing well. It's above 90. So you are doing well. So they will try to see, only diagnose and treat. What are some of the complications or some of the signs and symptoms you are facing. Then treating other underlying conditions, like I talk about the diabetes and then the hypertension. Then they'll do that. When you move to stage 2, where you are also doing well, but there's something that telling you that your kidney is not doing well.
Okay.
That one they'll further do a test to see, are you going at a faster rate? So normally you come for review maybe a number of times. As they do that, they'll ask you some questions about how you are doing. They look at your facial appearance, how your body, do you breathe well? Do you have any swelling at your face or your feet? They do that. And that one, they give you medications to continue. Then you move to stage 3, which is made up of A and B. That one, you are also still doing well. But there are things that are beginning to tell you that, yes, you have problem. That's where your BP is shooting up, the protein is leaking, then you have anemia and all those. They begin to set in. So they still do those investigations to treat you, and then make sure that the complications will come in. You try to treat them and make sure the patient does not the progression.
Yeah.
You slow the progression of the disease. Then when you move to the 4, whereby mostly a lot of complications set in, then at that moment, you know that, yes, one thing about the chronic kidney disease is that you are always mostly likely not to go back. You can't even go back. You are going down. Okay. But how do we do to make sure that you don't go at a faster rate? They say when you are having a chronic disease, do you still take alcohol? Do you still take food with a high fatty diet? Do you smoke? Do you check your sugar level well? Do you monitor your BP well?
Okay.
Yes. When they do those things, I'm able to help you. The medications alone may not do for you, because your lifestyle modification is very, very important here to make sure that you don't move at a space. So when you get there and the 4, you know, yes, you are at this stage, you are likely to go for, you will need, we'll call it renal replacement therapy, which Mr. Eric talked about, the dialysis and the hemodialysis, the transplant. So we do that to prepare you, to begin to tell you that where you are going, you may need to come for maintenance dialysis. Okay. Or you may need to get somebody to donate a kidney for you. When you reach the 5th, where we now say end stage kidney disease, whereby you now need, at that stage.
So the stage 5 is the end stage?
Yes. At that stage, you can still do well. We don't rush to put you on the dialysis because you are still doing well. Your BP, your vitals, and you are still breathing well.
But that's the point you also need a transplant.
Yeah, the transplant and the hemodialysis. And they will not do it. Therefore, we will prepare you because we need access. Okay. The vascular access is just a channel whereby we're able to get your blood to be able to, because the machine will need about 600 mils of blood at a minute to be able to filter or dialyze every distance. And with the hemodialysis, you spend about 4 hours on the machine, and you come 3 times a week. So if you are able to do that, we'll still do that. And now try to look for somebody who will donate his kidney for you to be able to survive.
So looking for that person, some things has to be compatible. Do you have to? Do you need to have the same blood group with the person donating to you? Do you need to have the same genotype with the person? Or what are some of the factors that would determine someone donating their kidney to me?
Yeah, you need a lot to be done. Before somebody will donate a kidney, you need to run a lot of investigations to know, is the patient, the donor, having any condition that is likely to even have an effect on them. You screen you a lot. And the blood, they consider is a factor because you kidney, giving an organ to somebody, it's a foreign body. Yes, normally we advise that those who are young and they are preparing to go for kidney transplant, we reduce the blood transfusion by giving them, maybe there are other ways of treating the anemia with the iron and erythropoiesis stimulating hormone. We do that so that we'll be able to make sure the blood level. But all those foreign bodies, if they are there, there's the tendency that the kidney will what? Your body will reject
Okay.
the one
The
that they
new
donate.
kidney.
Yes,
I
that
mean the
is-
kidney from the other person's
Yes, person,
body. Okay.
yeah.
But you can only donate if you have 2 kidneys, right?
Yes.
Yes.
Ah, okay.
And one thing that they don't just remove your kidney, as Mr. Eric said, the nephrons, which are the functional units of the kidney, they may be there. The numbers may be few, but how are they working? So before they do that, they need to make sure that your 2 kidneys are working, because somebody who is already having a problem with 1 kidney, you go to take the other one, then he will also eventually end up what?
Having kidney
disease.
issues and
Yes.
stuff.
So
I think I forgot to ask. I think I've ever heard that sometimes you, when you keep urine in your system for a long time, it can affect your kidneys and
Yes.
stuff. How does that work? Okay.
Yes, if you look at keeping urine in your bladder over a longer period of time, it can also affect your kidneys. We forgot to even add that, he mentioned it, but we didn't add it, that those with BPH, that is men who have prostate hypertrophy, it prevents the urine from coming out. So when it stays in the bladder for a very long time, they tend to go up through the ureters, and it's, urine is acidic. So as it goes back into it starts flowing back into the kidneys. So when they go in there, they start destroying these functional units, these nephrons, and you end up having kidney failure. So it's actually not good to keep urine for a long time.
Wow. Interesting. Like,
Then
because
also to add to the transplant, actually the tests are done with you and then the person you are donating to, so that
Okay.
they see that how your tissues are compatible. They do those tests. Then even after the transplant, they keep you on some medications for the rest of your life. Those are immunosuppressants. And these immunosuppressants,
and can you live a healthy life?
yes, you can live an optimal life after transplant. But these immunosuppressants prevents your body from rejecting the foreign body that is kept into your system.
Okay. 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 So now, just give us your final words on everything we've spoken about. I know we can't use one episode to talk about everything kidney, but what are some of the tidbits that anyone watching us should take home?
Yes, I think kidney disease is closer than we think, and the cost of treatment is enormous, and families are battling with these diseases because they're in our hospitals. The numbers are not going down; they are going up, and how to treat kidney is very, very expensive, and you need the support
Like how
of the
much?
family. Yes, like we talk about the transplant, you need about $13,000 to $16,000 to be able to undergo.
That's about 150,000
Yes,
cedis.
and you may need a donor to be able to somebody who will give you his kidney, normal kidney, for you to be able to live. And then the hemodialysis is also, the treatment is huge. It depends on where you are doing the dialysis.
Just to stay alive.
Yes, yes. It's not a cure to.
Yeah, that I'm
for
saying.
this.
At least it's something
Just to
that,
keep you
that
alive.
makes you stay alive.
So I would advise that people should go to the hospital to know your health status, which family do you belong to, and then try to find out why are you suffering from maybe a particular pain or persistent BP. You should always find out if there's a problem with you.
Okay.
Yeah, this is what I have to say.
Okay. Okay. Your final words.
I will also add that, my concern as somebody who cares for people having kidney problems is the fact that when you are diagnosed with kidney failure, that doesn't mean that is the end of the life. That is the end of your life. There is still hope for you. And in Ghana, the concern is that our NHIS doesn't cover kidney treatment.
Unfortunately.
Yes.
It doesn't cover a lot of things.
Yes. So, and kidney disease is one of them. So it is good that we actually do a lot of advocacy, a lot of education. Many people don't know some of these things we are listing to be the causes of kidney failure. So if we are able to create the awareness in the societies and those things, it will go a long way to reduce the numbers we are seeing. If you look at it, as you were mentioning, in Tamale here, our dialysis per session is 400 Ghana cedis.
And
Just
how
one
many
session.
times do one need a session for a month?
So let's take it slowly. So 400 a session. So you have to be on the machine for 3 to 4 hours. And after that, your 400 is gone. And you are supposed to do this 3 times in a week.
Not
So-
months.
No. This is just for a week. So you take 400, multiply by 3,
That's 1,002.
1,002. So you multiply that over a month. So you're paying like 4,800 in a month. So it is actually something that we all have to pay attention to.
5,000 cedis to buy more
Yes.
days of your life, because it's not even curing
That
you.
is excluding the medications and whatsoever. That is just the dialysis alone. And in other places, the prices vary depending on the centers. Kumasi, the price is different. Accra, the price is different.
No, I'm getting scared. Then this is something we really need to because looking at even how the economy is going, and you have to pay 5,000 cedis every month, not like you are going to even pay that and then it will just go, but it's just going to be manageable minus
Yes.
medications.
Yes.
Wow. I believe that this episode has really enlightened a lot of us that takes some things for granted, especially our health. I have been speaking with Mr. Dakura Eric. He's a nurse nephrologist at the Tamale Teaching Hospital, and Mr. Afim Pogu Simon Benako. He's a nephrology nurse resident at the Ghana College of Nurses and Midwives, also at the Tamale Teaching Hospital, helping us to understand everything kidney disease. In fact, I'm getting scared. I think I have to go to the hospital this week to check these things. I've been saying that
Very, very
I will
important.
go, but I keep postponing. But hey, I
Very,
can't
very
afford 5,000 to this every month. No, I'm not getting
Yes.
to that point. I believe that you at home who have watched or is watching this episode is changing your mind and your perspective about our health. Sometimes we take a lot of things for granted, and we don't even know that our health is very important, like our jobs. Sometimes you need to take a break from work. Just take a whole week. Go for some vacation. Just rest. Put your phones off or on silent and sleep, because your body needs to be strong for you and your family. When you go, who will take care of your family? Thank you very much for watching. I am Martha Inspire. See you same time next week.